Today I will be talking about prostate cancer. I will be talking about the pathophysiology of prostate cancer, its risk factors, pharmacological nursing interventions, non-pharmacological nursing intervention, post-operative wound care and management, patient education, discharge, and multidisciplinary support. This will be our case study. Prostate cancer occurs within the male reproductive system due to the uncontrollable growth of abnormal cells in the prostate gland, which may often press or block the bladder or urethra, causing issues with urination, sexual function, and may lead to the cancer to spread to other parts of the body. How common is prostate cancer? More than 80% of men diagnosed with prostate cancer were over the age of 60, while 1 in 6 men are likely to be diagnosed with prostate cancer at the age of 85. Risk factors. There are a number of risk factors towards prostate cancer that may cause a patient to become more susceptible, such as age, family history, diet, and genetics. In this situation, Nicholas' main risk factor is due to his age, 72, as more than 80% of men diagnosed with prostate cancer are over the age of 60. His family history or genetics also serve as a major risk factor due to his brother also being diagnosed with prostate cancer at the age of 48, whereas his mother passed away at the age of 60 due to breast cancer, which may indicate that Nicholas' family history or genetics which may cause the family to be more prone to other cancers. Early warning signs. Some early warning signs of prostate cancer may be trouble passing urine, consistently going to the toilet, blood in the urine, back pain, and growth within the prostate are some possible signs of symptoms that men must look out for. Pharmacological nursing intervention and pain management. Post-operative radical prostatectomy pain management in order to provide patient comfort and enhance recovery due to the abdominal incision. We can provide pain management by administering analgesic medications as prescribed by the doctor, such as paracetamol or opioids, which are stronger medications used to minimize pain. According to S. Hallengren, multimodal analgesia is required for pain management. Morphine is a powerful example of an opioid frequently utilized as it promotes better post-operative recovery and lower consumption of opioids, typically administered intravenously, combined with regular administration of paracetamol, with continuously being assessed using the numeric rating scale, which nurses utilize to assess pain scores from 1 to 10. Nurses must also assess if the medications are causing any adverse effects and identify the effectiveness of the medication through patient communication. Non-pharmacological nursing intervention for pain management. Physical therapy, perioperative education, and psychological approaches are vital examples of non-pharmacological nursing intervention for pain management, which contributes towards pain control, minimizing opioid use, and patient outcomes. Physical interventions such as massages, heat and cold therapy, meditation or relaxation techniques are effective non-pharmacological ways for pain management. Physical therapy such as early mobilization, minimal exercises, and positioning are vital in improving circulation and comfort to prevent stiffness. Cold therapy contributes in minimizing inflammation and swelling. Non-pharmacological pain management for Nicholas, following a post-radical prostatectomy, may include positioning the patient for comfort to reduce tension in the abdominal incision, applying hot or cold compress in order to prevent inflammation and swelling. Post-operative wound care and management. Nurses must perform regular and ongoing wound assessment and documentation of Nicholas's retropubic incision to ensure healing and early signs of infections. Nurses must assess for infections and ensure patient recovery by regularly analyzing the wound for signs of inflammation, such as redness, swelling, discharge, warmth, bleeding, abscess, and odor. Nurses must also consistently document and monitor the state or appearance of the incision, pain score, degree of tissue damage, size of the wound, and regular monitoring of patient vital signs, and administer antibiotic or analgesic medications as per charted or if advised by the doctor. Nurses must also continue to monitor Nicholas and escalate if there are any abnormalities in order to ensure early intervention of findings. It is also important for nurses to strictly monitor and maintain infection control of Nicholas's indwelling catheter, as it will remain in situ for 1 to 2 weeks, by ensuring that the catheter is secure and intact, whilst analyzing the urine color and output while complying to hand hygiene, perineal care, and sanitary precautions. Infection control and wound care. Nurses play a major role in maintaining infection control of wound sites to promote healing, prevent and manage infections by consistently cleansing a wound with aseptic non-touch technique, with normal saline or antiseptics, and regular changing of wound dressings to prevent bacteria and contaminants from infecting the wound. Nurses must follow strict sanitary guidelines by performing proper hand hygiene, utilizing sterile gloves, dressing equipment using aseptic technique to prevent infections and contaminations from the wound and indwelling catheter. It is also vital that nurses educate the patient, visitors, family members to adhere to hygiene and sanitary precautions and not to touch the wound dressing and catheter. They must also inform the patient to let the nursing staff know straight away if they notice complications or abnormalities. Patient education, discharge, and multidisciplinary support. Nicholas requires a detailed education and multidisciplinary support to ensure his recovery, wound healing, and prevention of possible issues through early intervention and self-management. Nurses must educate the patient about the significance of hygiene, symptoms of infection or inflammation, wound care. It is important that Nicholas is educated about maintaining hygiene and self-care. Nurses must also educate him about possible symptoms or early signs of complications so he can present himself early into the hospital. He must also be educated about the significance of proper diet, physical activity, wound care, and following medications as prescribed, and overall well-being. For an effective and educated discharge plan, it is highly valuable for patients to have a multidisciplinary team and allied health to communicate clearly with each other on the patient's next further steps into long-term recovery from prostate cancer. Patients such as Nicholas, age 72, require a more complex discharge plan due to their age, having a higher risk of developing greater complications if recovery from home doesn't go smoothly. This can include therapists, social workers, physicians, occupational therapists, and physiotherapists. It requires a multidisciplinary team to effectively support and contribute towards a patient's recovery, allowing full access to various specialists, knowledge, and expertise. There are various treatment options for prostate cancer. This includes active surveillance, surgery, radiation therapy, chemotherapy, hormone therapy, and immunotherapy.